guys are getting stuff ready, make sure you have all your supplies ready beforehand. So we're gonna pretend that this is a dog abdomen, and that it's already pre-up and we're already in surgery, okay? So this is our large drape, so that's what we would use for a canine. I usually always recommend keeping the tape, so like I usually will stick it to myself just in case there's something wrong with the pack, so that's just keep that in mind, okay? So then when you're going to hand this off to your surgical assistant, you wanna make sure that you're having this towards you and that you're gonna pull this away and then tuck it in. So you're like, how I'm gonna hold on to it, and you're gonna do that with every single one, okay? And then you're gonna hand it off to your person, okay? So we're gonna pretend that I'm the surgical assistant now, and we're gonna have this open. So, remember we're just gonna pull our tabs, and then this is gonna be ready. So mind you, keep in mind, I'm gonna be all gowned up, I'm gonna have my stuff on, and I'm gonna have my gown. So when it comes to grabbing your first towel, you're gonna put your fingers in these little loops here, and then I usually recommend bring it to yourself, nice and taut, and then this is where it gets tricky, where you move your fingers to hold onto that back piece. You see that? How there's two loops, and then you drop, okay? And then this is where you'll do that fold again. When the first drape that we do is nearest, so you always go about nearest to you, and then lay it down, just like that, okay? Then you'll do it, you'll repeat it the same way. Put your fingers in here, pull it taut, drop, and then wrap. And then you'll go farthest, so you'll go around the table and lay it down. And then again, we'll do our finger holds here, again, taut, drop, and then we'll do cranial. And then the last one. So then this is when we'll get our instrument pack and making sure it's open, and then we'll get our towel clamps. Do you guys remember which towel clamps goes on first? It'll be the back house clamps, the penetrating ones. And we wanna make sure that when we're going to penetrate and using those towel clamps, that we're actually gonna clip into the patient, get that skin, because otherwise it's nothing gonna keep that firm, okay?